Let me ask you something. If someone handed you a vial labeled semaglutide, would you know what is actually inside? Because here's the truth. Not all semaglutide is created equal. In this episode, we are peeling back the label to reveal what is really in those compounded GLP-1 injections and why it matters more than ever. I'm a pharmacist, and this is Pharmacist Online, making medication issues easy to understand. Today, we are diving into compounded semaglutide, what it is, how it is made, and the real risks that come with it. First off, compounded semaglutide is not the same as the FDA-approved versions like Ozempic or Wegovy. Compounding pharmacies create these versions when there is a shortage, mixing the active ingredient with other substances. But these compounded versions are not FDA-approved, and their safety and effectiveness are not guaranteed. And just to be clear, compounded semaglutide is not just semaglutide. The active ingredient is typically mixed with a few other components: sterile water for injection, sodium chloride to balance the tonicity, sometimes stabilizers like disodium phosphate to help maintain the pH. Some formulas even contain preservatives like benzyl alcohol to guard against contamination. And in weight loss blends, you might see add-ons like vitamin B12 or L-carnitine. But here's the catch. There is no standard formula. Each pharmacy decides what to include, and that can change batch by batch. And none of these ingredients, not even the semaglutide salt forms like acetate or sodium, have been officially evaluated for safety or effectiveness by the FDA. Moreover, there have been reports of counterfeit semaglutide products, especially online, or in off-the-books med spas and weight loss clinics. Some have even been linked to dangerous side effects like unexpected low blood sugar. So, what does this mean for you? If you are considering compounded semaglutide, it is crucial to verify the source, make sure the pharmacy is licensed, experienced, and follows rigorous compounding standards. Check the ingredients. Be wary of anything using salt forms of semaglutide, especially if the label seems unclear or oddly handwritten. And talk to your prescriber. Every decision carries risks. The best step is to weigh those risks with someone who knows your medical history. Because while these compounded versions might be more affordable, that lower price sometimes comes with less protection. You have the right to know what you're injecting, especially if it's fake. Coming up in the next video, click through. I will meet you there.